Your physician would like you to receive home health care. What does that mean? Home care is a specialized level of care that will help you reach your goals for recovery in the comfort and convenience of your own home. It's an important part of continuing your care and is one of many excellent services that Advocate Healthcare offers to our patients.
Everything begins with the physician. It's the physician who knows their patient the best. They do know that they're ready to be discharged from the hospital, but they are still in the middle of the recovery process. So the physician will write the order for home care to evaluate the patient and provide care. And then the physician also drives that care. So once we go to see our patients, we call the physician, we collaborate, and we make a care plan together along with incorporating the patient's needs.
Patients typically want to stay at home because they're more comfortable there. They know their environment, their family's there. It's a place that they can heal.
What kinds of patients need home care?
We see a wide variety of patients in home care, and they come to us for a variety of reasons. Sometimes it's a patient who's just had some surgery and is still recovering. Sometimes it's a patient who's had total joint replacement, a hip or a knee, and they need more therapy in the home. Sometimes it's a patient who is maybe newly diagnosed with a disease that needs to have careful management. They need to learn about it, such as diabetes or congestive heart failure. And then sometimes it's a patient who has had a complete change or many changes to their medication regimen and needs education on how to take these medications properly. And also, what to watch for, what side effects.
Hi, Dr. Ray. This is Maureen, the nurse from Advocate. I was just calling you.
Every one of us is very skilled in providing care in the home care setting. The nurse typically drives that care. They're usually the case manager and they oversee everything. And they work in collaboration with a physical therapist, occupational therapist, sometimes a social worker, and then sometimes a home health aide too. It really depends on what the patient's needs are and what the physician would like to have provided to their patients.
Home care is provided by a team. They work together to make sure you get the care you need.
As far as the home care team, we want to develop an integrated care plan. So that communication between all of the disciplines that's within the home is crucial in order to maintain that patient gets the best outcomes. So they go in and they do a home assessment as well. We watch a patient as they do their normal activity of daily living to see whether or not there are things that we can help them manage on an everyday level within their home.
Your first home care visit is very important.
No matter what setting our patients come to us from, it's important that they prepare for their first visit because it sets a tone for everything else that we're going to work on together. We need to understand their history. We're there to partner with them and help them accomplish the things that are going to keep them in their homes successfully and keep them as independent as possible. But another thing that they need to be prepared to do is show us all their medications, everything that they are taking, because they all matter and they all work together in your body. We need to understand what are their goals, what are their challenges.
Now what is that?
That's your potassium. Okay.
I'm not taking potassium.
Okay.
What is the role of the patient's caregiver?
A caregiver is something that's addressed even prior to the person leaving the facility to make sure that they have someone when they go home, that they have some support system that is available to them to help them with managing their disease, with maintaining safety within their home. The caregiver within the home can be a spouse, it could be a family member, it could be a relative, it could be a neighbor that they trust. That caregiver sometimes may be the person that's the voice for that patient as well. So that's why it's so important for us to make sure that we have a caregiver within the home as a support system to the patient and also as another resource for the disciplines that are coming in the home.
What happens after the first visit?
Each visit builds on the one before. A typical home visit will start with a conversation on what's happened since we last saw you. How are you feeling? Has anything changed? Have you had any new symptoms? What do we need to talk about? That's important because we need to know, again, where are we starting from and where do we need to go? We've gotten your medications straightened out at the first visit, but now we need to go and look at each one individually and teach you everything that you need to know about it so that you have more tools in your toolbox on how to best take care of yourself. And our goal at each visit is to make sure that you continue to recover, that you stay home, and that you are as safe as possible.
Everything you did before previously,
Right.
that helped the other one.
That
in
is very
recovery.
true, and that's
Yeah.
what they said at the hospital. I said, my therapist prepared me for this surgery.
Your doctor plays a very important role in your home care plan.
We are communicating with their physician so that they know the progress in which they're doing. We are the eyes and the ears of the physician. What we are to do is to reinforce and make sure that they still are managing and following their physician's orders and managing their disease at home. Home care will be different for every patient. It is based on the plan of care that has been developed for that particular patient. When a patient is ready to be discharged from home care, we contact their physician and let them know that we are going to discharge. It's sort of like a handoff that we give to the physician so that they know that we're no longer in there. So if they have any needs or any concerns, that they know how to contact their physician so that they can continue the care in which they need.
You have a choice of home care providers. Why should you choose Advocate at Home?
Advocate puts patients first. We've proven to pick out best practices that will have the best outcomes for our patients. We have caring staff that not only do the work, but it's a part of who they are. They have resources that we could tap into that will allow the patient to have the support in which they need. Resources amongst healthcare providers and resources within the community. Advocate serves everybody. It doesn't matter where you live, we serve the community. We meet patients' needs.